Analytic cognition is a slow, largely conscious cognitive process. It consumes more mental effort than automatic thinking and is much more tiring. It's associated with physiological changes such as raising blood pressure and heart rate. Its great advantage of automatic thinking is its flexibility. Automatic thinking depends on pattern recognition. It does not work well when no pattern is recognised and is prone to the error of recognising the wrong pattern. Analytic thinking is capable of assessing and avoiding both of these errors. Its disadvantage is that unlike automatic thinking, it must be positively engaged. We default to automatic rather than analytic mode. When a new situation presents itself, it is tempting to think that we can choose to engage in heuristics or conscious analysis from the outset according to the importance of the outcome. However, the evidence suggests that even when making critical judgments, as in medical practice, or when large incentives are offered under laboratory conditions, people rely on heuristics with its rapid, efficient but error-prone mechanisms. Although most errors occur because reasoning has been held up in heuristics, it can also be detrimental to be stranded in conscious analysis thinking. For example, obsessive-compulsive type behaviours or paralysis by analysis. It's not a good use of time to spend an hour deciding which can of baked beans to buy in a supermarket. The problem is the cause of Craster's well-known poem, Centipede's Dilemma.
The centipede was happy quite until the toad in fun said, "Pray, which leg comes after which?" Which brought his mind to such a pitch he lay distracted in a ditch, considering how to run.
Because it is a slow single-channel process, our ability to respond to situations with analytic thought can be impaired if the channel is preoccupied by other matters. Our consciousness is dominated by analytical thinking when we are engaged in it, and the conscious threshold for external stimuli rises. In extreme cases, this situation is known as fixation. In fixation, analytic thought is so dominated by one issue that the conscious threshold for sensory inputs is greatly raised, so high in fact that things such as warning sounds or lights or other people speaking are not registered at all. We drift into automatic thinking, but in this way we can get stuck in analytic thinking. For some problems, there may be no viable solution from analytic thinking. German psychologist Gerd Gigerenzer gives the simple example of catching a baseball. Here, the analytic approach suggests calculating all the variables involved: the speed of the ball, the angle and speed of the bat, the wind resistance, and so on. In reality, any such effort is quickly overwhelmed by the number and interaction of variables and fails in the face of limited capacity to process these in time. A simple heuristic of observing the ball and adjusting position to meet it works more quickly and more accurately. Heuristics are reliable as long as we have recognised the correct pattern or process, and they are usually appropriate. In our daily non-clinical environment, the sole operation of heuristics can lead to outcomes that are perfectly adequate, but not truly optimal. This effect has been named satisficing by Herbert Simon. In much healthcare decision-making, the bar is set higher. There is a greater need for optimal decisions, and thus a greater need for analytical input. Let's look at a common clinical situation. A patient has an initial wrong diagnosis induced by the similarity of their case to a more common or recently seen condition, an availability or salience heuristic, and which also appears to be a typical example of its class, a representative heuristic.
A 42-year-old woman presented to accident and emergency with an acute abdomen and was seen by a casualty officer who considered appendicitis the most likely diagnosis. They called the surgical SHO, who came to review the patient and found signs of peritonism with guarding and rebound tenderness and history consistent with acute appendicitis. The more general signs for bacterial infections, such as a coated tongue and fever, were lacking, but this does not exclude the diagnosis. The patient appeared reasonably stable. She was given antibiotics, painkillers, and an intravenous drip, kept nil by mouth, and scheduled for surgery the following day. Over the course of the next 6 hours, her condition worsened significantly. When the surgical registrar did his nighttime round before going home, he found the most obvious thing about her was not abdominal pain, but that she was pale and sweaty. A pregnancy test was positive. An immediate laparotomy was arranged, and bleeding from her ectopic pregnancy was successfully controlled. She made a full recovery.
This initial diagnosis was then reinforced by several other well-established heuristics: anchoring bias, confirmation bias, and premature closure. Treatment failure then triggered a switch to analytic thought and consideration of the combined probabilities of various differential diagnoses. In other situations, heuristics may have provided the correct answer faster and more efficiently, and with less effort. So, what affects automatic to analytic switching? One thing it depends on is personality. Aptitude for analytic thought, either de novo or in overriding heuristics, does vary from person to person and is a function of things like working memory capacity and IQ. Even clever people are quite capable of making gross errors of judgment through the automatic engagement of heuristics, as illustrated in 2007 in a study by Gigerenzer involving 160 experienced gynecologists. All were given relevant information in the form of conditional probabilities given as percentages.
Women in a particular region are being screened for breast cancer with mammography. In this region, the following observations apply. The probability that a woman has breast cancer is 1%. If a woman has breast cancer, the probability is 80% that she will have a positive mammogram. If a woman does not have breast cancer, the probability is 9% that she will have a positive mammogram. A woman who has tested positive asks what the probability is that she actually has breast cancer. What is the best answer to give her? A. It's not certain that you have breast cancer, yet the probability is about 81%. B. Out of 10 women who test positive, as you did, about 9 have breast cancer. Or C. Out of 10 women who test positive, as you did, only about 1 has breast cancer. Or D. The chance that you have breast cancer is about 1%. The best answer was in fact C, that about 1 in every 10 women testing positive has breast cancer. However, only 20% of gynecologists gave this answer.
Elements other than intelligence, experience and expertise are clearly operating. Context and environment matter, and heuristic-based errors are more likely when there are distractions or time pressures that reduce the attention available for conscious analysis. The manner in which information is presented and received is also critical. A major factor in switching is the nature of the judgment itself. Matters such as deciding on what car to buy, with numerous complex factors to consider, engage analytic thinking. Deciding which way to go on a familiar route to work engages automatic thinking. For the same issue, whether it is dealt with automatically or analytically is dependent on the way in which information is presented. A junior doctor asking their consultant about a treatment may present a clear and typical history with appropriate treatment suggested and ask, "Do you agree?" The consultant is likely to say yes, automatically. If there are ambiguities or inconsistencies between the clinical picture and the proposed treatment, the consultant is likely to deal with the case analytically. Each approach is appropriate to its situation. Analytic thought is not necessarily always the best.